Days before Delhi's landmarks and buildings virtually disappeared behind a grey haze of pollution, Nandini Guha left the city for a few weeks. Just months ago, medical tests showed that the long-time city resident had developed asthma.
I have already been put on inhalers and on nasal sprays, so I don't want to fall so sick that I have to be hospitalized.
Guha was heeding doctors who advise those who can to leave Delhi in winter when the city gets trapped in toxic smog.
Breathlessness, acute attacks of asthma, acute pneumonia, especially in young children and elderly. These are three immediate impacts that we see.
The long-term consequences are even more deadly.
To my mind, there is no true non-smoker in polluted cities, because whether you inhale pollution smoke or you inhale cigarette smoke, the effect on your system is the same. Both lead to higher incidence of lung diseases, including lung cancer.
In a bid to reduce the smog, nearly half the city's cars have been taken off the roads for 12 days by allowing those with number plates ending with odd and even numbers out on alternate days. Environmental experts say to clean up its air, Delhi needs permanent action to reduce the massive fleet of nearly 9 million vehicles clogging its roads by scaling up public transport.
The transportation sector will require the most disruptive action, because as you know that the dependence on personal vehicles has increased to such an extent, and the data in Delhi is showing that since 2010 the emissions from transport sector alone has increased by 40%.
That action will not happen soon. So doctors are focusing on sensitizing people about the most dangerous pollutant in Delhi's air, tiny particulate matter known as PM 2.5.
There's no point in talking to people about the numbers. If you tell them PM is 400, PM is 450, it doesn't really connect with them. But if you tell them that a 28 years old non-smoker girl in Delhi has got lung cancer, and that's probably because of the effect of air pollution, suddenly people sit up and take notice of that. So we wanted to use health messaging as a means of conveying the sense of urgency to people.
That is why for many children like this 4-year-old, indoor swings have replaced those in parks.
The maximum what we do is take her to play in some mall in the play area, but we don't expose her to the weather outside.
Some still brave the dense smog to enjoy a holiday. Anjana Pasricha for VOA News, New Delhi.